Doc Talk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, thanks for tuning in tonight to Doc Talk. We have Dr. Blaine Johnson. We're at Texas Tech School of Veterinary Medicine, where he serves as an assistant professor, and we're going to talk about bovine lameness. We're glad you joined us. It's bound to be a great show.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cuperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to Doc Talk. I'm Dr. Dan Thomson, and I'm here with Dr. Blaine Johnson. Dr. Johnson is a veterinarian here at Texas Tech School of Veterinary Medicine in Amarillo, Texas, and you focus on didactic teaching and clinical teaching as well as doing research, correct?
Yes, sir. Yeah, all the above.
All the above.
Yeah.
And we have a mutual connection. We're both from Southwest Iowa, so both raised in Southwest Iowa, both Iowa Staters, both went to K-State as well. He's a good dude. It's good to work with Dr. Johnson, great bovine veterinarian. And we're going to talk about lameness.
We are.
So how do we kickstart this? This is a big deal.
So with lameness, there's a lot of different issues out there. And just to kind of segregate it completely, the reason why it is an issue is because it becomes a welfare and a performance issue in cattle. Or one, we know if we see lameness issues, so if we see an animal that's obviously lame, he's either the motion of his body, his locomotion score is not normal, then they're in pain, obviously. And the next thing is, if they're in pain, they're not eating, they're not producing. So it's going to cost the producer money on the other end of the spectrum too. So we have two issues that we're actually battling with, welfare and the animal itself. So then you got to start figuring out how these lameness become such an issue. Is it from the source of the lameness? Is this a thing that an infectious cause that an animal got from out in the environment? Or is this a mechanical cause, either from a structural standpoint, from the claw issue, or more higher up in the limb internally, or within those two issues? Or it could even be something else, a nutritional type issue that is causing this, which could probably fall in that mechanical category as well. But the big thing is identifying where it's coming from, and then we need to treat both the welfare and the animal to make sure that we're doing the best as veterinarians and producers to get that animal where they're comfortable and back to being normal again.
Yeah, and these can have huge production deficit issues in these animals, whether we're talking about feeder cattle or we're talking about cows trying to raise calves or whatever. This pain or this syndrome left unchecked can cause pretty difficult issues for the animal.
Completely, and it kind of depends on what area or sector you're in. I mean, if we're talking feedlot and we have foundering issues, those animals are not producing, and ultimately they're not going to make it to their target end weight. So they typically get culled out of the pen early and sold off early at a discounted price. Mm. Or it could be an infectious cause that has gone septic or something else like that, where we really get a discounted price, or worse yet, the animal dies due to some sort of septicemia going on with it. So the best thing we can do is identify what the issue is early on and try to get after that issue as quick as we can with whatever therapy we have to target that issue. So the big thing you want to do is looking at your animals every day, identifying how they're moving and making sure they're either normal or abnormal. And if it's abnormal, we need to start figuring out why it's abnormal. Is it in the claw or is it higher up in the limb? And most of 80% of the issue is in the claw itself. And typically, a lot of people want to blame foot rot, but we'll talk more about foot rot here in a little bit.
Yeah, well, that sounds great. And like you said, you have to ground yourself that 80% of what's going on is in the claw. I keep chasing things up the leg. And as we'll get into on a better clinical diagnosis, we find out what what exactly it is.
Exactly.
Thanks for being on the show today. Thank you for watching. We're going to take a break. More from the School of Veterinary Medicine at Texas Tech with Dr. Blaine Johnson after these messages.
Hi, I'm Sydney Tuckwiller, and I'm a territory manager at Neogen. Today we will be discussing taking a tissue sample to send in for DNA analysis. Taking a tissue sample is as easy as tagging a calf. Taking a DNA sample for analysis is designed to be as easy and convenient for the producer as possible. Samples can be taken as a hair, blood, or tissue sample, but tissue sampling units are the recommended method. Here are 4 easy steps to collect a sample on your operation. First, choose which sample type works best for you. Second, order your sampling equipment, whether it's a TSU applicator, TSU tubes, blood cards, or hair cards. Then, collect the samples and send to either your respective association or directly to the Neogen laboratory, which works with more than 60 different associations. DNA will process for an average of 3 weeks, and then you will receive your results. You can collect samples at any time, but it is recommended to take them sooner, such as around birth, to allow time for the samples to be shipped to the lab and results to come back soon enough to have time to make decisions using the results. Genomics is an accessible technology that plays a pivotal role in cattle production to enhance genetic progress in a herd.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
Hey folks, welcome back to DocTak. Dr. Dan Thomson and Dr. Blaine Johnson. We're in Amarillo, Texas at the School of Veterinary Medicine, where Dr. Johnson serves as an assistant professor doing all things from research to teaching to clinics here at Texas Tech. And we're talking about lameness.
We're talking about lameness.
And so we've kind of talked about the syndromes and that, but now, how do I find one in the pen? And then after I find it in the pen, how do I figure out what it is?
Exactly. So that's probably the biggest thing, is identifying the animal who is lame. So finding out who is lame, that's probably easier than which limb is lame, because sometimes that can be tricky with the animal, because they're prey animals. They like to hide from the person that's observing them and try not to be pulled out of the pen, because obviously that's what we want to do, is get that animal out, look at what the problem is, and try to treat it to the best of our abilities. So if we're in the feedlot sector, or we're riding those pens typically every day, at least once a day for the most part, and we're watching these animals move. We're watching them move up to the bunk, up to the water, and trying to identify anybody who's either hanging back or has a little bit of a limp going on, or arched back or something like that. And there's locomotion scores we can assign to animals, and that's probably more common in the dairy industry, that gets observed by the individual more frequently. But as in the beef sector, we're looking at the feedlot, we're watching animals move as a herd, or we're out on pastures and watching these animals move as a herd. And the first identifier is if there's an animal that's away from the herd. That's probably the biggest thing to look for. If we have a cow or a bull or something that's way off on its own, we need to figure out why it's off on its own. We need to get that animal up if it'll get up. If it won't get up, that's another issue to talk about. Yeah. And try to get them moving to figure out what's going on with their limbs, if it is a limb issue. And then the next case is getting them into somewhere we can get them into a chute, hold them properly and safely, and try to figure out which claw or which limb is the affected limb. And the next thing I like to do is actually pick up that limb, because a lot of times this can get misdiagnosed. And my favorite case of misdiagnosis is the foot rot case that's been treated 3 or 4 times and not resolving. Because foot rot, if you treat it once, typically it's going to resolve. If it's true foot rot. And if it's not a foot rot case, then it's probably something like a sole abscess or a white line disease, or we could even be having an ascending infection into the deeper joint tissue and up into those tendons, which can be very problematic to treat at times. So we're going to get those animals in, really evaluate those the feet. If it's foot rot, it's going to have a very distinctive odor to it. It's going to have symmetrical swelling on both sides of that claw. If it's a sole abscess, typically we don't see symmetrical swelling. We might see asymmetrical, so one claw larger than the other, and we like to get our little hoof tester out and squeeze on and determine on which claw is affected. Sometimes we get the nice sign of pus shooting out somewhere, and then it's an easy slam dunk diagnosis, and the veterinarian will take care of that from there. It could be an extensive process to treat, but that's something that has to be done. And the other thing we look at is the actual claw itself to see if there's any lesions around it, like a heel erosion, or we're looking to see if there's any of this hairy heel wart that's going on. And that's very problematic if you ever see hairy heel wart. That one is extremely painful. You'll see cattle out there toe touching on it. They don't want to walk on it very well, and it can go through a herd very quickly depending on the environmental circumstances. More problematic, there's a lot of seasonality with a lot of these infectious diseases. If it's a lot wetter, more conducive environments, you'll see these diseases propagate and go through herds. Best thing you can do is get on it as quick as you can. That way we can treat it, either yourself as a producer or get a veterinarian to get eyes on it for proper diagnosis.
You bet. Well, just as kind of a wrap up, identify the animal that's lame in the pen, get them in, pick the foot up, look, see if it's foot rot, see if it's hairy heel wart. Then use your hoof testers to see if it's an abscess, a toe abscess, a sole abscess, whatever. Great information, Dr. Johnson. Thank you for watching DocTak. We're going to take a break. When we come back, we're going to talk about treatments. You're watching DocTak, and we're glad you joined us.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeda's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to BimedaBiologicals.com to learn more.
I've been a veterinarian since 1987. My wife and I set up a practice in Monette, Missouri in 1989. We started using therapies shortly after it came out. I was overwhelmed with the positive response that we were getting from producers. They could noticeably see a difference. I have to admit that I was pretty skeptical at first. I am currently 110% sold on the product. There is no doubt in my mind that this is an added product that we can use on these cattle that is going to make a significant difference.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTak. Dr. Dan Thomson here with Dr. Blaine Johnson, and we are in Amarillo, Texas. We're at the School of Veterinary Medicine at Texas Tech University, where Dr. Johnson serves as a professor here in bovine medicine. He works in the clinics, he works in the classroom, and he's doing a tremendous amount of research, and always has. He's done some great research in the feedlot industry that I've followed and used in my practice, and so we're very appreciative to get you on the show.
Happy to be here.
Great. Well, let's talk about treating lameness. And obviously it starts with a good diagnosis, but once we diagnose it, then what comes next?
Yeah, what comes next? We have to determine after we have our diagnosis if it's an infectious cause or if it's a mechanical cause. If it's an infectious cause, we start going down our antibiotic list. There are certain antibiotics that are listed for certain diseases. So like foot rot is carried on multiple different labels with different antibiotics out there. And the beauty with foot rot is typically it is very susceptible to most of the antibiotics that we have available for it. Now, if we get down to other infectious causes, such as sole abscesses can be debated whether or not it's an actual infectious or a mechanical cause, but it's something that we typically treat with an antimicrobial. Most of those that we choose to treat is extra label because there's really not a particular infectious source of cause of sole abscesses. And same with like hairy heel wart. There's typically nothing on label for a hairy heel wart currently that will typically, most of the time, if we have data to support it, include an antimicrobial to combat that disease. And then the other side of the spectrum here is if we see some mechanical issues going on. So big things I see on cow-calf or even in feedlot sectors is disorders with the claw. So what I mean by that, they could have like a toe tip necrosis or something like that if they've had some rough mechanical abrasions on their hooves. Highly excitable animals that have gone through some rough conditions of processing units and stuff like that. So with like a toe tip necrosis, that's something we have to open up and let that abscess drain out, or else it just continues to fester in that claw and to the point where it can go into that lower bone into the claw itself, or even start ascending up through the joint tissue and into the tendons and keep ascending up that limb. And once it starts ascending, that's where it becomes very problematic to deal with as an infectious standpoint, because it's really hard to get those antimicrobials into that joint tissue or into those tendon tissues because of the lack of vascularization in there. We can't actually get the drug to the bug per se. So most of the time you really need some highly skilled veterinary intervention there. And we actually have to go and debride some of that tissue, take away some of that dead tissue and flush it out, and maybe start using some antimicrobials a little more than our standard routes of putting them into the areas. If it's another mechanical issue like a claw disorder, if we have something like screw claw that we see a lot in our beef, cow-calf sectors, sometimes we need to start bringing those animals in about once a year and giving them a nice little pedicure. Bringing them in and trimming those feet down and try to get them leveled out so they're walking properly. And so that way it doesn't become a worse issue in the future. And what other worse things can happen if that cow's not comfortable, if she's stressing out, she's not going to get reproduced efficiently, and that's going to affect your bottom line. So yeah, it costs money to keep animals up and running, but there are negative consequences if we don't do some of these preventative health measures. And some of those are not seen directly. We see them on the back end. So it's just things to think about while we're looking at our animals every day.
Yeah, I concur. And getting the right diagnosis follows by the right treatment, and doing the treatment early is imperative to treatment success. Don't wait until you have a club foot to call the veterinarian, because then it's to the point where we can't do anything to help. Thanks for watching DocTak. When we come back, we're going to talk about lameness prevention with Dr. Blaine Johnson. You're watching DocTak. Thanks for joining us.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTak.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, Talk to your Merck Animal Health rep or your vet and see label at resfloorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome to DocTak. Dr. Dan Thomson here with Dr. Blaine Johnson. We're here at Texas Tech School of Veterinary Medicine, where Dr. Johnson serves as a bovine veterinarian and bovine professor here at the School of Veterinary Medicine at Texas Tech University. And just been a pleasure to have you on the show to talk about lameness, something that is probably only second to BRD when we talk about things going on in the industry.
Yeah, one of the more common issues we deal with has a lot of seasonality, and it comes and it goes. So we forget about it once it goes, but it comes back ugly a lot.
Yep. So let's talk about things that people can do to prevent lameness in their herd.
Yes. So from the feedlot sector, let's start thinking about our pen conditions. So a lot of this is environmentally driven. So as long as we can keep our pen conditions in an acceptable place, what I mean by that is well-drained, places for animals to go lay down that are relatively dry if possible, or decent bedding so it's not a whole rough surface for them to walk on. If we can keep them dry, that keeps all those environmental bugs away, so it keeps it less likely to have an infectious source get into the claw or the interdigital space between the claw. If we keep them well drained, that just helps them keep it dry. If we keep them comfortable, they're going to keep performing, they're going to keep eating. That'll keep the nutrition health balance fairly well. Other things we can start thinking about is when these animals come in off the truck into these feed yards is how we handle them, because handling actually has a lot to deal with how these animals get lame. If we have very excitable animals and we're handling them pretty rough, they can go really rough through a chute or through a snake or alleyway, and they can have upper level musculoskeletal problems from that, bruising, broken bones, issues like that, or they can even get something like toe tip necrosis if they're handled on abrasive surfaces and they slide around a lot. So we want to handle those animals very delicately, and that's where cattle management really comes into play here. And you want to be moving those animals appropriately and efficiently, because we need to get things done by the end of the day through chutes and systems as we're processing them, and just not being rough with them.
Yep.
So the animal is more important than the job most of the time, so we don't want to forget that. And then if we start thinking about the cow-calf sector, and we're bringing bulls in this time of year, it's spring, we're looking at bulls for BSE. One of the biggest components of a BSE is locomotion scores. Yep. So your veterinarian, even though he may just be going to collect the semen from these bulls, they're actually looking at your feet of these bulls as well, because that is the most important thing. If that bull goes lame on you, he's not helping you out at all. He's actually costing you quite a bit of money. He's not getting cows bred. So they're looking at the feet. They're watching them move through the system, making sure that they're adequate at the time that they're being evaluated. Now, we don't want to let that go. Once we turn them out on grass, we want to continually monitor that over time, because if these bulls are just sitting under a shade tree because they're lame, they're costing you money by not getting cows bred, which is what you'll see on the back end of the fall when you go to bring those cows to get preg checked, and it's a very costly endeavor. And then outside of that, you want to be watching your cows as well, because we start dealing with things like foot rot, or you can have hairy heel wart blow through potentially a herd, or just injury issues that we want to take care of as quick as we can. If we have cattle through a chute and we're at preg check time, it's a good time to look at their feet, as well as we're trying to identify that they're pregnant. If we identify cows that have really long claws or something that we can potentially prevent or do some preventative measures on and mechanical training by trimming those feet, sending them in for a pedicure, we need to identify those cows as early as possible so we can prevent that from progressing into a bigger issue later and more costly issue later as well.
Well, I think it's just fantastic information. Environment for our infectious foot diseases, cattle handling and docility for mechanical and non-infectious diseases, things that we need to focus on every day in our operations. Just working your cows. We don't want one animal to go down when we're doing it. So appreciate you being on the show.
Happy to be here.
It's great to have Dr. Blaine Johnson. Thanks for watching us today. Remember, always work with your local veterinarian, and if you want to find out what we do at DocTak, you can find us on the web at www.doctaktv.com. I'm Dr. Dan Thomson with Dr. Blaine Johnson from Texas Tech University, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
It's the drive, the passion, the unbridled desire to be the world's greatest. It's the early mornings, late nights, and every